My name's Peter Wood. I'm an obstetrician here at the Sydney Adventist Hospital and I've been working here since 2009. The first few days after the birth is some challenging times which, if you can prepare yourself for, can really make a big difference. Obviously it's the initiation of lactation, and so the thing that really gets your body geared up for lactation is the placenta coming out. When the placenta is delivered, there's a significant drop in estrogen progesterone, and that triggers the pituitary gland to release prolactin, which then brings on the milk. But fortunately, your body's clever enough to have some special milk stored in the breast called colostrum before the lactation fully is established. And when the baby's born, it's born with some special fat called brown fat, as opposed to the fat that we get when we're old called white fat. Brown fat is very good for a newborn baby to help it survive a few days while waiting for your milk to come in. So during those first few days, there's this establishment of lactation, and it's a relationship between your baby and your breasts and your pituitary gland that all key into making a successful breastfeeding situation. The baby will feed a lot in those first few days. The baby's stomach is very small. It only contains about 1 ml of capacity, and so even the smallest amount of colostrum will satisfy that baby, but it needs to keep suckling on your nipples to stimulate your pituitary gland to release the oxytocin and to release the prolactin to help bring on lactation. Somewhere around day 2, day 3, day 4, it's variable from person to person, your milk will come in, and it's usually a fairly dramatic effect where your breasts are engorged and the milk starts to flow. And at that time, a lot of support is required. And that's why here at the SAN, for people who have a normal birth, you stay for 4 nights after that, because we know that's critical in that time when lactation kicks in and when your baby, and when you'll need the support from the midwives and the lactation consultants. The other thing that can happen is the bleeding from the uterus will start to subside, but in those first few days, often some clots will come out, and the midwives will check those and will advise you if it's a concern or not a concern. And as you breastfeed and the release of oxytocin from the pituitary gland, that will give you what we call after-birth pains, which in your first pregnancy is not too bad, but after each subsequent pregnancy can become stronger and stronger. And you feel a strong contraction. Some people think they're having a baby again, it's so strong. There's adequate pain relief usually written up. It doesn't last very long. A heat pack can help. And by 2 or 3 days, it's usually all subsided. Believe it or not, this is actually a good thing, because what it means is that the uterus is contracting, and that's stopping you from losing blood, and it's helping your uterus come back into a normal shape. The last thing that can happen, well, there's many things more that can happen, but is that there can be an emotional change. Some people call this the baby blues, but it's a physiological change. Is that when that placenta comes out, there's a big drop in hormones, estrogen, progesterone. That's all been withdrawn from your body, and that sudden drop in hormones can have some emotional impact on women. So it's normal to be a bit teary around day 2 or day 3, so when the milk's coming in, it can be a bit teary or a bit moody, that's normal. If, however, somebody has some pre-existing mental health issues, such as depression, anxiety, or even things like bipolar disorder, this can really trigger a big reaction. And so if you have tendency towards that, your healthcare professional should have identified that during the pregnancy, and usually a strategy plan can be there to help. If for some reason it's not been picked up, normally the midwives will be very aware if they think that you're at risk of it, and will discuss it with you and your healthcare professional, such as your obstetrician, and may involve a perinatal psychologist in your care, which we have access to here at the SAN as well. Some women may have some stitches in their perineal area after the birth, and your obstetrician will have done that carefully, and all those stitches will always dissolve after 2 to 6 weeks' time. But in that time, it's important to wash regularly with warm water. All you need to do is just have a shower morning and night in that area and just wash it with warm water. You don't need to put any antiseptics or any cream on that area. Sometimes it may be uncomfortable or sting a little bit when you pass urine for the first few days, and the way to combat that is to just drink a lot of water, because that will make your urine more dilute. If it's a real problem, let your midwife know, and she can organise some other medication to help with that. It's also normal not to open your bowels for 2 or 3 days after you've had a normal birth, because I think your body's just too scared. But if things have not happened in that department in the 2 or 3 days' time, then again, we can arrange some appropriate medication to help get things going.